Hello, welcome to the Calf Rearing Excellence webinar for AHDB. It's all part of the GB Calf Week for 2025. We've got two amazing people to listen to this evening. I think that we'll just click on a slide. I've just got a few housekeeping rules before we move into meeting them. First off is you'll all be muted, so there's no actual communication via the microphones, and the event times are now through till 9 p.m. We will finish sharp at 9, and it's going to be recorded and made available after the event for everyone that's attended. If you've got a question, you can actually go into the top right of your screen. There's a box with a question mark. If you click on that, it opens up a bigger one. And at the bottom of there, you can type in your question, and we'll pick those questions up as they come through and take them either as we go, or if it's not quite just the right time, we'll just pass that back and just wait until the end. Anything that's not answered this evening, if we get a run right at the end, please keep typing in and pushing in there, because what we will do is we'll pull that all together and we'll get some answers and send those out with the link to the recording. Just as we start to move into this now, I'd really like to introduce Ben Strugnell. I've been very privileged to work with Ben several times on postmortems around the Northwest, and really bringing this whole subject of navels, colostrum, parasites, and bringing that to farmers in what's a really technical subject, but in a real easy way, so that we try and get more education out there to get a better survival rate for calves. So I'm just going to hand to Ben for a minute, just for him to introduce himself.
Yep, thank you, Carl. Pleasure to be here. I've qualified as a vet about 20 years ago now, and I was in practice for a while. Then I was at the VLA for a while, and then for about the last 10 to 11 years, I've been running a carcass-based diagnostic service in a fallen stock collection centre in northeast England in County Durham. So basically my job is to chop up dead animals all day and tell you guys why they've died. So part of the joy of being here is I can confirm that a lot of the things that we're going to discuss today are very common and often pretty easy to deal with. So I'm basically the guy you send the dead stuff to if you want to know what it's died of, amongst others. So, you know, looking forward to showing you how to easily reduce losses caused by mortality, and try to explain, and you can see with your own two eyes, how these things all work.
Perfect. Sounds a joy, Ben. Cutting up dead animals all day long and trying to educate people on how to really make the best of their animals.
Because I mean, you try to make something good out of something bad, hopefully.
Yeah. Next we'll come to Halcyon. Halcyon is one of my colleagues at AHDB. She works in the animal health and welfare team that bring masses and masses of really valuable information to you and for you to use. And you know, we really encourage people to actually look at the website and take that information on. But I'll pass over to Halcyon, who's going to facilitate this session for most of the time. Over to you, Halcyon.
Thanks, Carl. So I originally graduated as a vet in practice in 2021, spent a couple of years in farm practice, and then joined AHDB at the beginning of this year. And it's really exciting to be doing this webinar this evening. I think you're really going to enjoy it. We've got some films of postmortems that Ben and Carl did together, and we'll be able to talk through those topics. And if you've got any questions, we can answer those at the end. So we're going to start with a poll. We'd just like to know who's here this evening and what sort of farm you're from. So hopefully you'll see that on the screen now, and if you can just click that button, that would be great, and then we'll have a bit of a chat. Brilliant. I can see the results coming in. I'll share them in a second. So we've got mostly dairy farmers at the moment, about 30% beef farmers, and quite a few others. Fab. So I'll just share those. That's great. That'll really help Ben to tailor the conversation so it fits what you guys are are facing. And we've just got a second question. So the first video we're going to cover is looking at calves in utero. So this question is, what do you supplement your cows with during pregnancy? Do you supplement them with minerals or not? Great, I can see we've got over half of people voting. Most people in feed, and then again about 30% with boluses. Just leave it up for another few seconds and then we'll share those results. Real. So hopefully you can all see those. Great. So if we could get the first video, please, Kyle. And yeah, without further ado, off we go.
Okay, hello everyone. So here we have, this is a stillborn calf, and the purpose of having a stillborn calf is to demonstrate the challenges the calf is going to face while it's in the uterus and the things it's going to need while it's in the uterus from its dam, because life begins before the calf is born. While it's in the uterus, it needs to prepare itself for life in the outside world. And we're also going to use it to demonstrate things that happen to the calf in the immediate neonatal period. So we'll have a quick look at the calf to start with. We'll have a quick look in its eyes before we go to make sure it's not jaundiced or anything like that. And then we'll get into all the organs and cut them open. So first we start with the back leg here. So we open up a hip, and when we open up that hip, we have a look to see if we've got any joint ill. Then we open up this front leg here, and all the while, as we're going along, we are looking to see if we have any evidence of septicemia or anything like that. So what we're going to do here is get rid of the skin so that the skin isn't in our way when we're looking at the organs in the abdominal cavity. So the most important thing that a neonatal calf or a calf in the utero relies on is its navel, and here is its navel. This is the tube which connects the placenta, i.e. the cow, to the calf. So importantly, when it's in the womb, all the nutrients and minerals and everything that the calf needs is going in through this tube. And we will dissect now what happens to this tube when it goes into the body. So if I can just get rid of this skin here, and I will show you exactly where this tube goes when it goes into the body here. So if you can picture this tube here, just trying to make it continuous. So this is the outside world. It goes through that little hole there, which is the navel, and then it goes into the calf with this tube here, which heads towards, as you can see here, the bladder. Just going to open this up so that you can get it in context and you can see the lungs at the same time. So here we have the navel here taking nutrients into the calf, and it goes straight in through this tube here, and you can see just here, this is a continuous tube here, in here, up this, which is called the umbilicus, straight into the calf's liver. There's the calf's liver there. Can you see that? So this tube is going straight, continuous from the outside world and the placenta, the placenta, through this tube directly into the liver. Once it's in the liver, it goes to the heart, and the heart pumps all those nutrients around the body, and then they go all the way around the body, and the calf does its thing and gets rid of what it needs to get rid of through the kidneys, which eventually go to the bladder, which go to this tube, which is called the urachus, and then the material, the excreting material, the stuff the calf doesn't need, goes out of here, and then it exits via this umbilicus here. So once again, nutrients from the cow placenta in to the umbilical vessel, to the liver, round the body, and anything the calf doesn't need gets excreted through the kidneys here and through this urachus and then goes out. So this is how the system works. Now, importantly, we have to remember that, as I said earlier on, the life of the calf does not begin at birth. The life of the calf begins before birth, and it relies from its dam on various important nutrients which it's going to need for its life outside the womb. The first of these is selenium, which it needs for a healthy immune system, another thing. The second of these is copper, which it needs for healthy bone growth and tissue growth. And the third of these is iodine. And all of these come either from the umbilicus or are inhaled, but mainly they come from the umbilicus. And the important thing to say here is that the transfer of these nutrients is much more efficient through the umbilicus via the placenta into the calf than it is after birth through milk. Also, if you have these nutrients before the calf is born, then the calf hits the ground running with a full tank of minerals in order to successfully thrive in the world. If you wait until after the calf is born to give it those minerals, you may find that the fact that it doesn't have them causes it problems. Much better that it's born with them. So that is the situation while the calf is in the womb. The other one to mention is iodine. Okay, now the calf also relies on the placenta and the cow for its iodine levels. And the main job of iodine, if we can go to the front end here of the calf, is to provide adequate thyroid function. Now, if I can just show you quickly, here, can you see this all right, is the thyroid gland. So this is just near the calf's, this is the calf's windpipe and trachea. This here is the thyroid gland. I hope you can see that clearly enough. The job of a thyroid gland is to suck up the iodine that it's receiving through the umbilical cord into the calf, and then it sucks up all the iodine. Iodine is used in thyroid hormones, and thyroid hormones are essential for two important functions. One is to trigger birth. So if you're short of iodine, then sometimes the calves can go over dates, which means that they can be too big, and that means that they can die because of dystocia and getting stuck and all the rest of it. And calves that are deficient in iodine may be dopey when they're born, and then they may die because they're dopey, and they may die for that reason, or they may die of secondary infection. So iodine in utero is extremely important to make sure that the thyroid function is okay. The second thing that the thyroid does that's important for neonatal life is to make the lungs, here are the lungs, and you can see here that these lungs are uninflated, which in contrast to the calf later, which will be inflated, but these ones are uninflated and these will sink. The thyroid hormone makes the lungs ready to be born for the outside world and makes them expand. So if you're short of iodine, you're short of thyroid hormone, and the thyroid hormone will mean that the calf forgets to be born and that the calf's lungs aren't ready. So this is particularly for suckler calves born. Very important that you consider where is this calf getting its copper, selenium and iodine from, and the answer is through this umbilical cord, i.e. from the cow via the placenta. And it's important that you start to think about these things on your farm when they're in the womb, when they're first conceived, rather than when they're actually born. So plan ahead. For dairy calves and for rearing calves, this is probably a bit less important because dairy cows will be receiving a fully supplemented diet, which means that deficiencies in those sort of calves will be less common. Really talking about suckler calves here. Now, so that's the situation when the calf is in the womb. So this all changes very rapidly, as you can imagine, when the calf is born. When the calf is born, instead of needing it, so suddenly when the calf is born, it has to change from drinking amniotic fluid through its esophagus here. It's drinking amniotic fluid, and that's where it's getting some its sort of sustenance from. Suddenly, when it's born, it has to start breathing air. So that's why it needs its thyroid hormone to be working, all the rest of it, because its lungs stop from being full of fluid to full of air. Then its heart has to start working, and all the rest of it has to start working. And all that happens very quickly and very suddenly sometimes.
Brilliant. So we just put a pause in there because it sums up really nicely how important those minerals are. And Ben, just wanted to come to you and see really what you recommend for when cows should start getting those minerals in their feed. And we saw we've got quite a lot of dairy farmers here who'll have it in feed anyway, but is there anything in particular that you want to emphasize for them?
Yes, I think the dairy farmers can probably rest assured that they're okay. In fact, with the dairy farmers, their main problem is that, especially with copper, that the calves don't get too much copper. So sometimes you can over supplement dairy cows with copper, and that affects their calves when they're born. But for suckler cows, I think the time to start thinking about it is 4, 5, 6 months in calf. So importantly, analyze the silage, and we'll come back to that later to see what the copper and selenium and iodine levels are like, and also blood sample. But I think if you want to start supplementing, then the question is what. So that's the answer: 4, 5, 6 months. Then we move on to the question of what to supplement with, and it's probably in this order. Boluses and injections are the same, then in feed, then licks, and licks are probably the worst because they're unreliably taken in and unevenly spread throughout the various cows. Sorry, yeah, some cows will lick them, some won't. Therefore, some will pass the minerals on to their calves and some won't. And there's some debate about whether you actually get the daily dose that you need from the cow to the calf. That's copper and selenium. Iodine is a bit more complicated in how to measure it, because some of the blood tests for iodine you can do in cows are sometimes quite difficult to interpret. I think the thing I would say about iodine is if you're having a problem with calves that are a bit dopey or not getting up or not sucking or a bit non-viable or even stillborn, the thyroid, you need to take the thyroid, or get your vet to take the thyroids out and have a look at the thyroids, because the thyroid gland is the determinant of whether or not there's been enough iodine. And if you do that early on in a calving period, then it's not too late to supplement the rest later sometimes.
That's really useful, thank you. Brilliant. So the next video that we've got is a little bit about colostrum. So we just have another question for everyone. Here we go. Let me launch that one. So Ben's going to carry on in the video doing that post-mortem and have a look at the GI tract. And yeah, we thought it'd be really interesting to hear from people what you do if you don't, if you're not sure if that calf has had colostrum.
Interesting question.
I know it's something that it's a challenging time, particularly for people that perhaps are on more isolated farms or haven't got other herds nearby. But yeah, definitely something we'll touch on soon. So I can see just over half of people have voted. And we've got a bit of a mixture here. I'll just give it another couple of seconds.
At least the right answer has the majority.
Great. Fab. So if we could have the next video, Carl. Thank you.
The other thing we need to say while we've got this calf out, and this is, remember, a stillborn calf, is that a calf is born. This is what a calf's abomasum looks like. This is his first stomach. This is what this calf's abomasum looks like before it's born. There's just a bit of mucus in there, and he has absolutely no milk in there to start with, which means he hasn't yet got any immunity. So if you have a calf which is born and you leave him to suck on his mother, and then he dies, and he has an abomasum that looks like this is his stomach. By abomasum, I mean stomach. Then you know that this calf has died because he's not got up and sucked. And sometimes it can be quite deceptive. A calf can be looking like he's sucking, but actually he's not, and he can die of not having sucked. I don't know the history of this calf. It is possible that this calf is in that category, or that he's died very quickly, but I think this is probably just mucus. Now you can see here, this is the rumen. So this is the main stomach that the calf is going to rely on when he's an adult cow and ruminating, or a beast and ruminating. But that stomach is very unimportant when it comes to a firstborn calf. The main stomach he needs is the abomasum, which is here. And so the tube which goes into the abomasum is the esophagus here. So as you can see, here's the esophagus, and if we follow it all the way along, here's the larynx, and here's the epiglottis. When he swallows, he closes that epiglottis. The milk goes down this tube. It goes behind here, behind the lungs in his chest, and then it ends up. This is the same tube here. As you can follow it all the way along, just behind these major vessels in the heart. And there we have the abomasum, the esophagus rather, going all the way along. If I can just free it up here, can you see? And the idea is to pour some milk into this tube, bypasses the rumen, goes straight into the abomasum, and then once he's had 10% of his own body weight in colostrum, then he has an immune system. I should just explain that it's a quirk of ruminants, cattle and sheep, in that there is no immunity crosses the placenta. So this calf has no immune system to anything that is in the outside world because of the nature of the placenta. No useful immunity to the outside world crosses the placenta and goes up the umbilicus from cow to calf. So when he's born, he has absolutely no immune system. So any bacteria in the outside world can come and kill him straight away. He must drink at least 10% of his own body weight. So for a 40-kilo calf, that's 4 litres within the first 18 hours of life. And this is why, right? I'm going to explain why. What happens when you put milk into the abomasum? The milk finds its way into the small intestine, which is here, right? Here is this calf's small intestine. Now, from the small intestine, it needs to be absorbed. And you can just see here, here's the small intestine. This is like a tube as well. And what happens is these blood vessels here absorb all that immunity, which goes into the calf's bloodstream. And that is basically his immune system for the first month of life or so. Now, here's the important thing. This can only happen, the antibodies that are present in the milk, in the colostrum, can only arrive in the bloodstream via the small intestine here, can only be absorbed at this point here for 18 hours after birth at best, sometimes only 12. Do you see what I mean? After that, they go straight through and out the other end. So this 12 to 18 hour window is your golden window where the antibodies and immunity from the cow in the form of colostrum in the abomasum stomach, those antibodies can only be absorbed into those blood vessels for 12 to 18 hours. So this calf must receive all those antibodies within 12 hours of life. Otherwise, they cannot get absorbed and get into the bloodstream. After that, he's buggered and they're just going to go straight through. This is the reason why, if you give this calf some cheap colostrum that doesn't have any antibodies in, all that opportunity for those antibodies to be absorbed is wasted. The calf doesn't go and drink anymore because he's full, and all the chance that these blood vessels have got to fill themselves up with antibodies is wasted because there are no antibodies in the artificial colostrum that you've given him. He must have his own dam's colostrum or colostrum from another cow. That's the only way he's going to get the antibodies into this stomach and then be absorbed into the small intestine and into the bloodstream. That's the only way your calf is going to get all his nutrients. And that, together with the open umbilical cord, this is the sort of 2 most important things you can give a calf in the first 48 hours of his life. You dip his navel so the bacteria don't get in, and you fill him up with colostrum so that he gets an immune system into his bloodstream. Otherwise, he's going to die of an infection that's in the uterus. Sorry, in the environment, I should say, in the environment that's just going to be there waiting to kill him. And if you're not careful, that's going to kill him. And I can tell you that on my table, we get plenty of calves that do succumb to these things. The first 48 hours of life in a calf is absolutely critical, and those are the two most important things that need to be got right.
Great. So I think we all hear a lot about colostrum. It's something that everyone's really aware of, but there are some really key things that can influence the success of that colostrum in the calf. And just wondered, Ben, if you wanted to touch on what factors influence that quality and the quantity that that calf can get.
Yes, excellent. So shall we start with quality? Quality of colostrum is important because there's no point having quantity if you haven't got quality. So quality is basically determined by the protein nutrition of the cow in gestation, especially in late gestation. So dairy cows, obviously, they're well fed. They're normally, the quality is not a problem. Normally their only problem with quality is that it's too dilute by the volume of milk that they're producing. Suckler cows is different. With suckler cows, it's much more likely to be a nutritional deficiency in the cow in late gestation. So it's important, especially this year, probably, where some people, certainly in the northeast of England, are short of forage because of the drought, and sometimes the quality and the quantity of the forage, and people are going to be feeding straw, that sort of thing. You can get an idea of what the protein supply to the cows in gestation is likely to be, and therefore how much protein is able to be put into colostrum by doing metabolic profiles on suckler cows with roughly 6 to 8 weeks before they calve. You can measure albumin, urea and BHBs, and that will give you an idea of the adequacy of the diet while you still have a chance to turn it round. So with suckler cows, it's what you supply them that determines how much the quality of the colostrum, and with dairy cows it's more like how much milk they're giving. You can measure the quality of the colostrum very, very easily by buying yourself a colostromometer, and I can't think of a better thing to buy somebody in calf health week than a colostromometer, because it's very simple. You dip the colostromometer in the colostrum, and it measures what's called the specific gravity, and it's a very good proxy for how much protein, which is i.e. how much antibodies are in that colostrum. And the first few cows that calve in a calving period, if you're a suckler herd, or if you're a dairy herd all the time, measure the quality of the colostrum, and then you'll have confidence that the quality is there. So that's what influences it, and that's how to measure it. That's quality. Quality is critical. They say that heifers don't have tend not to have as high quality colostrum as cows, but all the more reason to measure it. And then next one is quantity, as was mentioned in the video. Quantity has to be 10% of body weight, which is basically 4 litres, which is basically a lot. So you just have to make sure that these cows are getting 4 litres of colostrum. Now, if you're a dairy farm and you can tube them, then you know that it's gone in. And again, I said 12 to 18 hours. Really, there is a case to say the sooner the better. So within 2 or 3 or 4 hours of life, they should have half of that 10%, and then probably 6 to 8 hours later they should have the other half if you're giving it to them. So quantity is important, and just get your head around the fact that is a lot of colostrum. If I was to go to the pub and drink 8 pints, that is a lot, and I'm twice the size of a calf, so it's a surprising amount that they need. And then, of course, you can measure the combination of quality and quantity in the calf, either by blood sampling calves less than 10 days old and then measuring their protein levels. They have to be more than 24 hours old, is it, Halcyon? But less than 10 days old, to measure whether they've acquired the right number of antibodies that they're going to need for the first month of life. You can, and it's very important. If I had suckler calves, I would measure the first 10 calves that were born. Then they've got both. If you've got adequate numbers of that blood test is adequate, then you've got quality and you've got quantity. So you can measure it in the cow when you put it in. You can measure it in the calf, so that both are done. But you cannot overstate how important it is. And it really is a straight line. The more, the better. previously they used to think it was a bit of a cut-off. If you got above a certain level, then you were okay. But actually, all the more recent data shows the more colostrum you do, the lower the mortality, the lower the morbidity, the faster you grow, the better you are. Just more is more is more. More is better. And I was very
Brilliant.
pleased.
Yeah.
And I'm sure you agree with me that powder colostrum is the worst and own dammed colostrum is the best, assuming you give them enough.
And what would you recommend for people who really, you know, they've ended up in a situation where they can't get colostrum off of any other cow? What would you recommend in that case?
Well, go to a friend. If you're a suckler calf, go to a friend who's a dairy farmer if he's any spare colostrum, and if you can freeze some. Next best is, if you really must, if you really haven't got any other choice, then go to your vet to get the colostrum, that's the commercial colostrum sold through vets. And I think that's where it ends. I wouldn't do anything else. I wouldn't use any other option.
Yeah, really sound. Yeah, brilliant. So the next video we've got is about calf navels. So we've just got another poll for everybody here. Let me pop that one up. So
The yin and the yang of neonatal calf health, navels, and colostrum.
yeah, exactly. I think these are the two big topics of this evening, aren't they? Really, yeah. So got a bit of a split going on here. I'll leave it up for another sort of 10 seconds or so. So there we have it. We've got dip leading, and then we've got about 40% on spray. So if we could have that next video, please, Kyle.
Let's see who's right.
The other thing that happens is that these two tubes, although they're essential when the calf is in the womb, they become something of a liability when the calf is in the outside world, because what you've got now is a tube, an open tube here in the form of an umbilicus, which bacteria from the outside world can say, right, we're going up that tube, and that is our route in to go into the calf. And it's basically an open door to the body of the calf, which is not got much of an immune system yet because it's so young. So here you have an open door where the bacteria can go either in there, straight up this tube. You can see, as I said before, this is a continuous tube, straight up there into the liver, where it can set up an infection. And from the liver, it can go to the heart, it can go to the brain, it can go to the lungs, it can go to the kidneys, it can go wherever it likes all the way around the body of the calf. Now, that may be E. coli, it may be salmonella, it may be any other environmental infection. Doesn't matter what it is. The fact is that it's there, takes its chance and goes up. That's if it turns left, it can go into the liver here. If it turns right, the infection, the bacteria, it can go up this urachus, which is the tube which leads, whose job is to get rid of the stuff that the calf doesn't want in utero. But after birth, the bacteria can go up this umbilicus into the bladder, and then you can get abscesses and things in the bladder, which then can ascend up to the kidneys here, which are located here. This is the calf's kidneys, and then you can quite commonly get abscesses in the kidneys, which either leads to death or poor performance in these calves. So that is the real risk. So the most important thing you need to do with any calf, be it a suckler calf or be it a dairy calf or be it a calf of any description, is to dip its navel. Now, dipping navels is much more effective than spraying them, and I'll show you why. I'm going to get a pot here. If I dip this navel, you can see that I'm dipping the entire navel into some fluid there, and the entire tube is being submerged in that antiseptic fluid there. And if I turn it upside down, I'm literally going to pour the fluid into the middle of this tube. So I'm coating the inside of that tube with my antiseptic fluid. Do you see what I mean? Whereas if I spray the navel, all I'm doing, I'm going to pop and get one. us before. If I spray the navel, I'm spraying on here, and I'm spraying the outside of the navel, can you see? Whereas the inside of the navel is completely unaffected. So I'm spraying the outside, but the bacteria say, thank you very much, I'll just go up the middle, and you still may get navel ill. Now, so dipping is much, much better than spraying. And then there becomes the question of what you actually use to spray these navels. The recent data suggests that there's a new substance called Nobax, which is excellent at shriveling up this navel so that there is no longer a tube and the bacteria physically can't get in, so that there is just no hole and they get completely blocked. That's by Nobax, which also has antibacterial properties. It's just as important to disinfect the navel, to desiccate the navel, as in to shrivel it up, as it is to use a disinfectant to kill the bacteria. So you have to do two things, both of those things. And Nobax, recent data shows, is the best way of doing it, dipping with Nobax. Other alternatives include iodine, but if you use iodine, you have to make sure that there's enough spirit within the iodine so that the navel desiccates and shrivels up so that there is no potential hole, as well as just disinfecting the outside. So then people say to me, how often should I treat navels? The answer is as often as it takes for the navel to shrivel up and so that there is no potential hole into that navel, into that calf, via the navel at all. So if that means you do it twice, you do it twice. If that means you do it 10 times, you do it 10 times. And every time you walk past that navel, you have to dip it for the simple reason that the bacteria are queuing up to get into that tube. And then, as you can see there, you've got a direct route straight into the liver and straight into the bladder on both sides. And the tubes that were being used for the benefit of the calf in the womb suddenly become a liability when you're in the outside world and you've got 10,000 squillion bacteria suddenly wanting to go up that navel. The other thing to say is that environmental hygiene is important, because if you've got 100 bacteria wanting to go up, you might be able to fight them off. If you've got 10,000 squillion bacteria wanting to go up, then obviously the risk is much higher, and the navel dipping is going to have to work even harder to prevent that infection. So that means clean straw, it means environment not too hot, as in the muck underneath the cattle is not too hot to facilitate bacterial replication. But it means, so the environmental hygiene is not, is not to be underestimated in the importance of preventing navel ill. The other important thing in preventing navel ill is if you've got a big calf that's been born with a lot of dystocia and has a headache, he's going to sit down in the muck, and while he's as long as his navel is connecting with the muck and is in contact with all the muck, you've got lots of bacteria going up this navel and into the thing. But if you have a little calf, which is an easy calving bull, pops out, jumps up onto his feet, he's stood up and he's sucking, the contact between the bacteria and this navel is much, much shorter and much, much less. And so you're going to have much fewer problems with navel ill. Doesn't mean the navels don't need dipping, they still do, but the risks are much lower. So you need a calf that, in summary, you need a calf that has adequate copper, selenium and iodine before birth, and after birth you need a calf that's had its navel dipped, that's going to get up quickly, and that's born into a clean environment that's not going to result in navel ill like that. So those are the principles of navel hygiene, and that's the science behind it. I can tell you that in my daily life, I still find an embarrassingly large number of calves that die either during the neonatal period or up to 3 months old of diseases that they contracted during the neonatal period as a direct result of navel ill. So it still remains a problem, and it's an easy problem to solve and doesn't cost you a lot of money, just a bit of care and attention and forward planning.
Yeah, really emphasising there how important that step is with dipping the navels. And you mentioned about desiccating, so drying them out, as well as antiseptic to kill those bugs. Just wondered if there was anything you wanted to touch on when people are looking, because there's so many products available on the shelves, and you mentioned a few there, if there are just anything for people to look out for.
yeah, it's actually very surprising how little hard evidence there is about different products and their effectiveness at preventing navel ill. And that's why in the video I mentioned this recent work that's done by Novax, where they developed this product called Novax, which is a little bit like I wouldn't know anything about this, Halcyon, but it's a little bit like shellac that ladies put on their nails, and it was originally used to waterproof the bottoms of boats. Anyway, it produces a barrier. That's the bottom line. It produces a barrier so that the bacteria can't get past it. So they persuaded a load of farmers to, instead of using whatever they would normally use, didn't mind what they used, most of them would use iodine, they swapped it over for Novax in half the cases. This is in a load of lambs. If they were spraying, they still sprayed. If they were dipping, they still dipped. And the results were pretty impressive in favor of Novax. I think there was something like 5 or 10% increase in survival, growth rates, reduced mortality, all that sort of thing. So if you can get hold of Novax, which is spelled Nobacz, from your farm supply shop, then all I would say is the available evidence, and I suppose we have to say we are still early days, but the evidence such as it is shows that Novax has been pretty effective. After that, and hitherto, iodine with spirit has been extremely effective. After that, after those two products, they tell me that copper sulfate is good at drying up navels, but after that, the evidence is very thin, and I'm not sure really anything else much could be recommended. So I do hear people spraying navels with blue spray, Alamycin or Gentian Violet or whatever it might be. I don't think that can be recommended really and truly. And I still, believe it or not, come across people who don't do anything with navels, which is again surprising. So in short, I think if I could, personally, I think all farms are different, right? And I think what works on one farm doesn't necessarily work on another farm, either because of the cocktails of bacteria or because how likely the cows are to lick the navels once they've been dipped and all the rest of it. But if I was to start from scratch and make a recommendation, I would probably suggest dip if you're spraying, and dip with Novax at the moment, but dip often. And every time you go past a calf, check if its navel hasn't dried up, then dip it again. And that may seem like a pain, but I can promise you that it's money, time well spent. I think we should mention how common do we think that this is. Well, there are, in my experience, I've got two pieces of evidence about that. When we started doing the fallen stock project way back in 2014, navel ill and lack of colostrum came out as the main causes of neonatal mortality when we took an epidemiological look at it. The second thing, and all the data agrees with this. The second thing that I find as a sort of looking from the other end of the telescope, if I'm trying to find a calf for a demonstration for some reason, if I've got farmers or vets or somebody coming round, and I randomly off the pile pick a calf that's less than 10 days old, I would say probably in half the time, half the number of cases, that calf has some degree of navel ill, which is very sobering. And I am aware that this is repeated and repeated and repeated and repeated. We've been saying this for years and we sound like a broken record, but I can promise you that it remains a big problem. Sometimes even if you think a calf hasn't died of navel ill, then it might have done.
Yeah, really, really critical. Yeah, I hadn't appreciated that's such a high figure there. And just very briefly wanted to touch on, yeah, early days for Novax. Evidence looks great right now, but yeah, we'll see what happens. If you're trying to get hold of iodine, then it's that minimum 7%, ideally 10% that we're looking for. But yeah, keeping on navels, we have got another video, if we could put that on, Kyle. So it's just really emphasizing what Ben's just said and some of the problems with navel ill.
Okay, go. So here we have a slightly older calf, which is in contrast to the stillborn stroke neonatal calf we were talking about before. And so this is kind of that calf plus probably 3 or 4 weeks. And this is what you can see what happens sometimes if what goes wrong if you don't dip the navel. So here you can see the same vessels as I was talking about before. The navel, the external navel has disappeared, and by now, by 3 weeks old, 4 weeks old, these vessels should have completely shriveled up and gone. But as you can see, one of them has, the one that goes to the liver is no longer there. But as you can see, the one that goes to the bladder, the one if you turn right, this is still here, which makes me think that some infection has gone up here and then made the thing not recede. And you can see, look, there are some attachments here between what's called the urachus, which is the next step along in the tube from the umbilical cord, and that's attached to bits in the abdomen, which it shouldn't be. Now, if we go through here with a knife, what we can see is we have a nice bit there of pus. Can you see we've got pus there in the middle of that tube? That's infection which has remained from when this tube has been open too long and infection has got in. Can you see that? So let's cut further up here and further up here, and you can see how that infection is right within the calf's body, and he has just been able to have a complete pub core. You can see there behind my hand that there is pure pus right within the system of the calf. So that will straight away lead to either a quick going or a slow going septicemia. And you can see how old this calf is. He's not going to die in the neonatal period when he's a couple of days old. He's clung on and clung on and clung on, and he's not died till later. But there is a good demonstration of navel ill. And just to reiterate, here's the navel. If I spray it, I'm going to spray around the outside there, and I'm going to get the outside, and the middle, my spray is going nowhere near. If, on the other hand, I dip it, here's my dipper, I'm going to dip my navel and my antiseptic solution and my shriveling up solution is going right in the middle of that tube, and you can see there that it's getting the bacteria that's in the middle. You can see the bacteria there in the middle of the tube, in the hollow bit of the tube, in the lumen of the tube. There is where my antiseptic is going. If I dip the navel, if I spray the navel in contrast, it's just going on the outside. So once again, dipping is better than spraying. And once again, what with Novax is probably best, then iodine with spirit is probably second best. Other things like alomycin spray, copper sulfate, other things like that, is very difficult to recommend them because there is no hard evidence behind them. And especially when we know we have stuff that works, why not use the stuff that works? So that is a good example of a chronic navel ill, and you can see how much pus there was in that navel. Hope that's clear, and that navel should by now have disappeared. So the other thing to say in a slightly older calf is, is that you can see how much bigger the rumen looks. This is a calf here. This is his rumen now. So here we have some grass, although this grass is very dry, probably because this calf has had septicemia for a long time. That's his rumen now. His rumen starts to get bigger and the abomasum starts to get smaller. Now this is a calf that should have milk in his stomach, but he hasn't. Because he's had chronic septicemia, you can see he's bled into his stomach, probably because he's had chronic infection for so long. So you can see there's blood in his stomach rather than milk. And I just think this is probably gone a bit too far past it. But sometimes that can happen with if his kidneys get infected, but generally speaking, he's probably just had chronic septicemia for so long that he's bled into his stomach. Stop that.
Yeah, really, it's such a shame, isn't it? See, yeah, not a nice end, not a nice end for a calf. We thought we might do a bit of a double act now and get Carl back on, because Carl in a past life has some experience working with a suckler unit and also finishing some bulls, and really wanted to talk about there are obviously reasons why people are not dipping navels, you know, the small number of people that aren't, and some of the barriers to that, and then how to overcome them, and a bit of a practical session on, yeah, how to actually get those navels dipped in calves in difficult circumstances.
Yeah, we were 100% dip unit. There was no exception to it. And I know that previously Ben's always talked about how many times do you need to dip those navels. We would check a minimum of 3 times a day whether navels were drying, whether they were still wet. I should say that we were sort of quite a high volume of cows. We were in a very fortunate area, and we only housed for the calving period, and that was quite selfish reasons for housing. It was just a management system, and it did aid us to actually manage those navels really well. When 10 cows and calves were ready, then they got shipped back out into the field. Everything came in just after New Year and was out by the end of February. And that was sort of the tight period that we worked in, because we just needed buildings to actually turn around for other projects then. But in terms of difficult cows, we didn't have difficult cows, because once they became difficult, they were down the road and replaced. And that might be an expensive way of actually managing it, but actually safety needs to be paramount as well. But in the time that they were with us, a cow that felt was a little bit difficult would be fed a little bit while we dealt with the calf, and not a lot, but just enough to keep her interested away from it while we dealt with that navel dipping system, and that worked really well for us.
Fantastic. Yeah, Ben, did you want to come in with
Yeah,
some things?
I think the conversation about how to prevent, how to deal with navels is multifaceted, more multifaceted than at first sight it would appear. For the reason Carl said, if you have an aggressive cow and you can't dip her calf's navel, that really is no good. So it's a fine line, isn't it, between selecting for a maternal cow, but selecting for a maternal but not aggressive to humans cow. And there may be a case for saying, if a cow's going to be aggressive when you're trying to dip its navel, then maybe that's not the sort of cow you want to be breeding from again, so it can rear that calf perhaps, and it can go. The other cow attributes that are probably important is pelvic size, so that if one of the risk factors definitely for having navel ill, i.e. for not getting up quickly, and that being a risk factor, will be dystocia. And dystocia is one of the determinants of dystocia is pelvic size. So pelvic measuring of heifers at selection will directly lead to a reduction in navel ill by enabling the calves to get up quicker, because calving is sooner. So these are tools that are out there, reasonably easy to use and able to be done. The other one is gestational length and size of calf and easy calving and all that sort of stuff, which is a bull EBV. So you want the bull attributes and the cow attributes all to be taken into consideration, as well as all the other aspects, like aggression and things, and figure out a way that you can dip those navels without getting killed, whatever works in your system. But I would suggest both of those things should be given to some consideration. And I actually wonder whether AI isn't used enough in suckler herds. Just anyway, and those are two things. Well, the gestational length anyway is one thing you can be sure of if you use a bit of AI with the intention of breeding female replacements to prevent navel ill, amongst other things.
I would think that AI in suckler units, Ben, is not used very much at all. We were 200 plus and we never had an AI in the place. We were on 4 bulls.
I agree. And people always say, well, I don't want to use AI because I don't want to get the cows and calves in while they've got calves and all the rest of it. But could do heifers, couldn't you?
Yeah, and realistically speaking, once you start to manage a system, actually the system starts to manage itself a little bit as well. and you start to build all that time into it. Safety always has to be paramount when you're dealing with large animals, and we've always got to bear that in mind. Suckler cows are never going to be as easy as dairy cows just to manage or an AI system, because they're not handled 2 or 3 times a day. And that is also just another added factor into that safety issue.
There's a lot of tools in the toolbox, isn't there? There's lots of ways to approach the problems. So the next video we've got is a bit of a change of direction. So we're going to be talking a little bit.
The one thing we ought to probably mention we haven't yet is how to, if you have a calf that's alive and you think has navel ill, then what to do with that, how to diagnose it, how to treat it, how to mention it, how to deal with it, and all the rest of it. And I would just say that any calf that's looking sick, it is worth having a feel of the navel and where it goes in, and you will be able to feel those 2 vessels that we saw in the video. You can feel those with your hand. If you follow up where the navel stump is, if you can feel them at all in a calf that's about 2 weeks old, they shouldn't really be there. And I can probably say with some confidence that if you can feel them and you think they may be navel ill, then what you can see from the outside is probably a lot worse inside from what I've seen in the past. When I've felt them on the outside and opened them up, always worse on the inside. So if you've any suspicion of it, consult your vet, and she will give you the best thing to deal with that, because it may not still be too late to treat it if you have a calf that you think has had navel ill that's still alive.
Yeah, fab advice.
Yes.
Right.
Sorry.
Just in the interest of time, we'll just move on to the next one, and then we'll have time for more questions at the end. So we've got a bit about pneumonia now, and I'll just pop that up and give everybody a few seconds to answer this one.
There's also just a question coming while this is going through, which is, at calving, if the umbilical cord doesn't break away naturally, what is the best way to deal with that? You're on mute, Ben.
Oh.
Does that mean if it's still attached to the placenta?
I would say so, just looking at that, yeah.
I think that probably is reasonably rare when the cow stands up and things like that. I would think
perhaps,
I would, go on.
I was just wondering if it's perhaps, when they have a really long placenta, I'm thinking perhaps lambs, and they're trailing on the ground, sort of what's a safe length that you can trim them to?
Yeah, how big is that? 6 inches? What would you say? Shorter than that? 4-6 inches, I'd say. As long as you use something clean, I don't think it's clean scissors. I think you can probably cut them.
Yeah, and then dip that straight away. Yeah, sounds very
cut and dip.
sensible.
Yeah, don't want a long trailing one.
Fab. So we've got pretty much everyone voted here. So we've got majority are vaccinating for pneumonia and a few are not. So great. If we could get that next video, Kyle. Thank you.
Okay, so here we have removed the heart and the lungs from the calf. So the heart and the lungs are among the organs that face challenges in the young calf. So I'm just going to quickly explain the anatomy here. Here we have the epiglottis and the voice box, right? And when you're tubing a calf, what you're doing is you're putting a tube in there and you're wanting the calf to close his epiglottis so that your tube can go down the esophagus here. That's the food pipe. So the food pipe, where the food goes is just above the voice box here, and you want him to close that off, and then you want your tube to go down into this pipe here, and this pipe here runs all the way along parallel to the trachea, which is the windpipe, all the way around the back of the lungs and between them, and then to the guts, which are down there. So what we're going to do is we're going to open that tube out all the way along there, and that is separate. That is a separate pipe from the airways. So that's what you're trying not to do when you're tubing a calf. And then we have the airways here. I'll just get my knife to demonstrate this. So here I'm going to chuck this all the way along so that we can see all the way down the airways. And as you can see here, you've got your trachea there, which is lined with this firm cartilage here, so that the trachea can't be squashed. So this is the windpipe, so that the idea is if you get squished between the two gates, you can still breathe, because this is difficult to squish in here. You see what I mean? So the main thing that goes wrong in neonatal calves, in little calves, is that they get viruses, namely RSV and PI3. And what they do is they make the calf unable, because when we're breathing in and out all the time, we breathe in a certain number of bacteria, and then there's a mechanism which takes the bacteria from down the bottoms of the lungs back up to the top of the trachea and the windpipe, so that those bacteria can be swallowed. Now, what can happen in calves of 2, 3, 4, 5 weeks old is that they get a virus, RSV or PI3, which is a little bit like our coronavirus, which often doesn't kill them, but it just removes their ability to get those bacteria that they're breathing in every day down from the bottoms of the lungs here, back up to the top of the lungs here. And as I say, it might not kill them, they just lose a little bit of lung and a little bit of lung and a little bit of lung and a little bit of lung every time when they get that virus, and every time they breathe in, because that mechanism for getting rid of those bacteria from the bottoms of the lungs is damaged. And that means they don't grow as well, and that means they're much more prone to bacteria earlier on in their lives caused by other things. Now, the reason for saying all this is because there are vaccines available, rather, for these viruses, vaccines available which you can give in very young calves, which prevents those viruses from damaging the lungs in that way from day one. So those are the intranasal vaccines for RSV, PI3, and bovine coronavirus. Mycoplasma bovis can also be vaccinated for as well, and it does a similar thing. So the idea is you're giving this calf the best preparation for later life, for it to have optimal lung health throughout its lungs. I can tell you that the commonest cause of death, certainly in rearing calves, is pneumonia. And what people say to me is, I'm using antibiotic A and that stopped working, so I started using antibiotic B and that stopped working. Now I'm using antibiotic C and that seems to be working for now, which is completely the wrong question to be asking, because what's generally happening is those calves that are dying of pneumonia later on in life are only dying because the damage caused earlier on in life by viruses hasn't been prevented by vaccination, and the mechanisms by which the bacteria are got rid of from the bottoms of the lungs back to the top of the lungs have been damaged by viruses. And the reason they've been damaged by viruses is because those calves have not been vaccinated early enough in their lives. And there are not many calves in any circumstance, be that suckler calves, rearing calves, or dairy calves, that wouldn't benefit from vaccination against these important viruses early on in their lives. So that's why I mention it now, because any calf you have, you need to consider, do I need to give these calves a virus for these a vaccine for these viruses early on in life to prevent. You've got a nice clean set of lungs here, you know, they're springy, they float in water, they're full of air. You want to keep them like that. The last thing you want is for bacteria to be ending up down here to kill the calves. Now I'm going to get the heart out. You can see how closely opposed the heart is to the lungs, and I'm briefly just going to chop this heart up to show you. So here we start. You've got two sides to the heart. You've got the left-hand side and you've got the right-hand side. Briefly, what we want to do is we want to expose the valves. So we want to open up all those heart valves, get rid of those clots, and we want to tidy them up. So we've got the right-hand side of the heart, there's the heart valves there, there's the heart valves there, and then we quickly look on the other side of the heart. This is the left-hand side of the heart, which pumps blood all the way around the body. There we've got two heart valves, and there we've got two other heart valves. And sometimes if you have bacterial infections, they can end up on these heart valves, and that can cause problems, slow-going septicemia in calves. And it all comes back to navels and colostrum and things like that. Any way infection can get in, one of the places it can settle out is in these heart valves, and that's important. The other reason for looking at the heart, especially in young calves, is to make sure we haven't got holes in hearts or congenital heart defects or anything like that, which could be a genetic issue, which is worth finding out if you've got that present. So those are the important things in the young calf about the lungs and the heart, which are two intimately closely related organ systems. And there's plenty you can do with the available science and vaccine ranges that we have to give your calves the best start in life by vaccinating it against the viruses that will set it up for clean lungs later on in life.
Right. Just wondering there, Ben, if there was anything you'd recommend. There's so many vaccines on the market, for how people can choose which ones would work best on their farms.
Well, the short answer is ask your vet, but what I would say is that these three main lung viruses, RSV, PI3 and coronavirus, are on every farm just about. They are ubiquitous viruses. It's a bit like COVID, it's a bit like the flu, it's a bit like, adenoviruses in humans. These viruses really are ubiquitous. Now, as I was trying to explain there are three possible outcomes when you get a virus. One is nothing. If you get a low dose of virus, you might just get over the virus and become immune. That's possible if you're low stocking density, all that. Two is you die, because you get such a high dose of virus that you die all of a sudden. But three is, and this is the most common, that you survive, but you survive with damaged lungs. So I think all the viruses are all effective at preventing damage. The vaccines I should say are all effective, and they're all much of a muchness really. Don't know, there's a great deal to choose between them. Just ask your vet whichever one they recommend or have had most success with. But I think the virtue of the intranasal vaccines is that, one, you can give them very young, and so protection occurs very young, from a matter of days old, and secondly, they affect the nose cavity, so that some of the antibodies that are produced are already in the nasal cavity and then the further down in the lungs, where the real viruses are going to come and act. So you're stimulating immunity right where it's needed. The important thing is to give these vaccines as soon as possible, because every day the calf is alive and not vaccinated, that's another day that the lungs, the airways could be damaged, and if the airways are damaged, that's going to compromise the calf's ability to get rid of those bacteria that he's inhaling every day. So the actual vaccine, I don't think it matters, but I do think you have to give it some consideration, even if you apparently have no problems with pneumonia, because these vaccines are ubiquitous. I would give some thought about vaccinating for them. I think that's really the answer. Early, and consider. And sometimes you might need to give them 2 doses, but be advised by your vet on that subject.
Ben, is it worth just touching on bacterial load from air constraints?
Yeah. So definitely there are 3 probably things that are important. One is the viruses themselves, which are primary pathogens. 2 is ventilation, because what ventilation determines is it's the number of bugs in every mil of air. So if you've got good ventilation, you've got nice cold clean air coming in, diluting all those pathogens, which makes it more likely that a calf will get 1 or 2 bacteria or 1 or 2 particles of viruses, and that will shift the probability in favor of them getting over it. If the ventilation is bad, especially at calf level, it makes it much more likely that you've got more bacteria per mil of air, because they aren't being diluted by clean air, and that makes disease more likely. The other third thing in the triad is humidity, because humidity will increase the survival of these bugs in the air. So if you've a warm, humid day with fog and things, the more humidity there, more water there is in the air, the better these pathogens survive. And all these things can be measured, and all these things can be tipped in balance of your favor. Ventilation, you can do a smoke bomb in the house, but the house has to be full when you're doing that. And humidity you can measure by monitors and stuff like that. So I would say those are the 3 things: deal with the vaccines, deal with the humidity, deal with the ventilation. But if I could just stress again, I'm sorry to repeat myself, if I could just stress again, so many of the cases of pneumonia that I see where people say the antibiotics aren't working, it is not that the bacteria aren't working, it is that the problem in the lungs has been going on too long because it wasn't prevented early enough. You know, it's not the fact that the bacteria get to the lungs and the bacteria are the antibiotics get to the lungs and the bacteria are resistant to the antibiotics. That is not the problem. The problem is that the bacteria have not been got rid of because of earlier airway damage, which wasn't prevented by early vaccination.
Yeah, really, really key. And with those vaccines, there's just so many on the market, and I just want to really briefly touch on how they all have different marketing authorizations. So it can be a bit confusing because some will say start at 2 weeks of age, some will say start at day one, and I just say follow your vet's advice and that data sheet because they've done research with that vaccine based on that date. So if you're wanting to find one that starts early, speak to your vet or look in the packet. It will say on there start at day one. Yeah, and just follow that advice really. So we have another poll question here about vaccines. So the last video is going to touch on the GI tract. So it'd be great to know if people are vaccinating to protect their calves against scour. And we'll give this one about another 20 seconds or so. And of course, with these vaccines, it's a bit different, isn't it, Ben? They're applied in a very different way.
Yep, you're vaccinating the cow to prevent the calf. So the vaccine is the cow is injected, you know, before she calves, a month and 6 weeks before she calves, and the idea is that the antibodies are then created by the cow and sucked by the calf in the milk, and they're by the colostrum to start with, and then later on, as the cow produces milk, there are enough antibodies in the milk, even milk, not colostrum, that stay in the gut and mop up all these viruses and bacteria to prevent the calves from getting scour.
Yeah, brilliant. Again, really emphasizing just how crucial that colostrum is. Fab, I'll just share those results there for everyone. So it's much less common that people are vaccinating against scour.
Yes,
so,
I think that's it's sort of fair enough because those vaccines are quite expensive. I mean, I imagine people don't do it because they haven't had a calf scour problem. All I would say is if you do have a calf scour problem, it is much more expensive and a nuisance to treat than prevent these calf scour issues.
Yeah, definitely. Should we get that video up and we'll have a good chat through? Fab, thank you.
All right. So here we have the dissected out guts, i.e. the gastrointestinal tract of a young calf. So I'll go from head, this is our esophagus coming in here, and here we have the rumen, here we have, that's stomach number 1, then we have 2 little stomachs, the omasum and the reticulum here, they're not important in the young calf. Then we have the abomasum, this is stomach number 4, this is like our stomach. Then we have the small intestine here, and then we have the cecum and the colon. And what we're just going to do is go through organ by organ to tell you what's important about these things. So this is a calf that's just been born, so there's nothing in his rumen, only mucus. Same as his abomasum. This is the stomach, this is what a calf stomach looks like, which has had no milk. So it's just got fluid in it, that's all. This is where the importance of the colostrum needs to go, and that's for the calf's immunity to see him through the rest of his days. So that's the abomasum there. Then we move into the small intestine. Now the job of the small intestine is to absorb things like protein and energy that the calf's going to need to grow. So that's what the small intestine does. And then you can see here, as we were talking about before with the colostrum, those are the blood vessels from which the things get absorbed. So they go into the system and then they get absorbed. And then we have the large intestine here, the cecum and the colon. And the job really of the cecum and colon is to absorb water that's left over. So the main problems that a calf faces in its gastrointestinal tract when it's a young calf will be, first of all, E. coli when it's sort of 1 to 3 days old. And really the only reason a calf will get E. coli enteritis, as in an E. coli infection in its guts here, is either because you have a nasty strain of E. coli on the farm, or simply because the calf hasn't had enough colostrum, because the colostrum is your main protection against E. coli. And to diagnose E. coli, all calves will have E. coli in their feces here, but to diagnose E. coli, really, you need to have a look exactly what's going on in this gut here in the small intestine. So ideally, in an ideal world, you need to get a fresh calf and you need to have a look at what's going on in that gut under the microscope. That's to diagnose E. coli. To prevent E. coli, it's things like environmental hygiene, colostrum management, and there are some vaccines which you can give to the cows before they calve in the same way as rotavirus corona, which we'll talk about in a minute, so that the specific immunity in colostrum, which ends up in the abomasum, fights off the E. coli that's going to act in the small intestine. As the calf gets a little bit older, you start to get things like cryptosporidium. Now, cryptosporidium is like an organism which colonizes the entire gut here and here and just damages the lining of the gut in here, so makes the calf scour and get very, very dehydrated very, very quickly. Cryptosporidium, there are treatments for cryptosporidium, but the main issue with cryptosporidium is it probably is a disease of high stocking density. So the first thing to do is to improve environmental hygiene and remove and reduce the challenge by Cryptosporidium oocysts, the millions of squillions of Cryptosporidium oocysts on a dirty environment, but it affects the lining of the small intestine here and the large intestine here. The next two are two viruses, rotavirus and coronavirus. Again, they affect the lining of the small intestine here, and the small intestine has lots of little villi like that, which increase the surface area to absorb all that good stuff. What rotavirus and coronavirus do is they flatten out all those villi so you can't get absorbed, so the stuff stays in the gut, so the calves get scour, and you scour out through here, through the colon, like that. Again, environmental hygiene is important because it depends how many viruses you eat. If you eat 10 viruses, you'll be okay. If you eat 10 squillion viruses, you might get scour and you might die. Again, if you're having problems with rotavirus and coronavirus, then look to the cow, because you can get vaccines that prevent rotavirus and coronavirus by providing specific antibodies in colostrum for calves. So basically, neonatal scour, as often as not, comes down to environmental hygiene and having the right vaccines in the cows. The other one would be Salmonella. Now, Salmonella comes in two main forms, Salmonella Dublin and Salmonella typhimurium. It's important to know which one you have on the farm, but that is easy to grow. You just culture the feces and Salmonella will grow. In fact, all these diseases, mostly you can find out most of what you need to know by just sending a sample of feces into your vet or to the lab and find out what grows and then putting it into a clinical context. When calves get a bit older, then coccidiosis becomes a problem, and coccidiosis does similar to what rotavirus and coronavirus does. It just goes into those foldings of the gut, flattens them off, and invades into the gut, so you get hemorrhagic scour. But generally that isn't until sort of 4 to 12 weeks old in older calves. So these are basically the main enteric challenges that calves get, which we can talk about later in the discussion.
Great, that's a lot of information packed into a few minutes there. And just, yeah, is there anything, Ben, that you wanted to bring to people's minds, particularly? I'm thinking about hygiene and how crucial that is for scour.
Yes.
And prevention.
Yeah, I mean, you can't overstate it, really. I think plenty of straw and plenty of room and space, I think, because the infectious dose, as in the number of bacteria or viruses or cryptosporidia that are ingested, is the critical thing for whether the calves become immune or whether the calves get sick or whether the calves die. So plenty of cleanness, plenty of straw. If you do know that you're going to struggle for straw, or that you're overstocked, or that you know, there may be other risk factors. That's when you might need to rely on the immune system a bit more. So you know, if for any reason you know that there's a high stocking density coming, then now it's not too late to start using vaccines for these likely pathogens of the gut.
I think as well, Ben, we've probably got you know, from the dairy side and the calves coming through that side, the clean equipment and the cleaning regimes for that to actually minimise bacterial impact from that element as well.
Yes, I agree. Yes, I think that's really important.
And with those disinfectants, particularly with cocci and crypto, it's finding the ones which are actually effective against them, isn't it? And sometimes some of them aren't effective at all. They're great for all the other bugs that we find on farm, but those cocci and crypto bugs are so resistant to all kinds of cleaning products. You really need something that works against them. So definitely worth asking in the farm shop or your vet for advice on those.
They're very persistent, aren't they?
Yeah. Just sort of, should we get on to some questions now from everybody?
Well, there's no questions arrived just yet, so I think that unless some questions
I can see quite a few, Carl.
Can you?
Do you want me to, if you go to the top, So we've got one here which says, Ben, could you please talk everybody through how young calves might be damaged by poor tubing techniques when people are tubing colostrum?
Yes. So when you're tubing a calf, you just put the calf some of the way in, and as you might have seen in that video, you have to just tickle the calf at the top of its throat and then let it swallow it, and sort of loosely have it there, and it needs to swallow it. There are two things really. One is if your tube is old or not very supple or soft, then it can damage the actual esophagus itself. That's the feeding tube. So if your calf feels in any way hard or rough, then you need to just get rid of it and get another one. The other thing that people always worry about is tubing milk into lungs. I don't think that happens as much as people think, because I actually think it's quite difficult to tube calves into lungs. But if you do it, just put it in perhaps that far and then just wiggle it about, and you can always feel the calf swallow it. And once it's swallowed it, then you're in. And sometimes you can, if you can feel it on the outside of the calf's neck, then it's not in the esophagus, because it's not in the trachea. If it was in the trachea, you couldn't feel it. If you can feel it on the side of the calf's neck, working its way down, then it's in the right place. But I do think that it's important to disinfect these tubes between calves, not least because you can spread Mycoplasma bovis quite easily that way. And I do think it's important that they're supple and soft.
Fab.
Good question.
Great. We've got another question here. Could you advise any ways in mitigating the Johne's risks from cows to their calves? Probably just top two tips, if we could keep it to
that. They say that you bet. I think really the cop out and short answer is ask your vet. But if you have a calf, this is probably the answer is different for dairy cows than for suckler cows. If you have a Johne's positive cow, then really speaking, its milk shouldn't really be used in colostrum. But overall, I think the colostrum is more important than the Johne's risk. I'm going to say it.
And if you come across, sorry. Just going to say, pasteurization I know has really helped some farms with these problems and for their colostrum. Yeah.
I think that's probably the answer. Yes, I should have said that in the first place. I think, pasteurization is good in all sorts of ways if you can. And if I'm right, Halcyon, it isn't as much of a hassle as people always think. It's not as difficult as you first think, is it? Pasteurization.
From people I know that have gone on to it's changed their lives, and they'll swear by it, and it's worth whatever hassle it is, for sure. Yeah.
Yeah, and I think that probably is the answer. And it's excellent for Mycoplasma bovis as well, which is a significant problem on dairy and suckler. Well, mainly dairy farms, but suckler farms as well. But I do think if it's a choice of colostrum or powder, irrespective of the colostrum, then I think colostrum is better.
got a good question here with somebody who says that they found that by dipping navels, I'm assuming rather than spraying, it can cause a swelling, but if left alone, they're fine. And they'd like to know sort of why that might be, or some techniques to stop that from happening.
I've never heard that one before. I would perhaps suggest dipping with no backs. Hard to, if you can reply, whoever answered that question, what you were dipping with. I've never heard that one before, and I would suggest try no backs because I would think that would solve the problem.
I suppose the only thing I can think of would be just hygiene around that dipping cup, because obviously if you're going from calf to calf, it's always something worth cleaning out every now and again. It's got a disinfectant in it, but we know that if you get muck in there, then it's going to be less effective. And yes, okay, so she's replied and said it's iodine and the cows keep licking it off, which
well, yeah, that's all the more reason to keep trying something else. If that, this is a thing that pops up every so often, and I don't really know the answer apart from try something else. Try putting in copper sulfate, because copper sulfate's bitter, and that might prevent them licking it off. Try putting in phenol, that's quite bitter too, but also try Nobax, because Nobax is pretty bitter as well. I think the answer is trial and error, and they will eventually desist.
Great, thank you. We've got a question here with somebody saying that they vaccinate calves from a week of age, but they find that the calves tend to get pneumonia even younger. And obviously we've spoken about vaccinating calves from 1 to 2 days of age. And yes, I suppose it's a bit of a question about working out when to do that, how to get those.
Well, I think the most important issue there is to establish a diagnosis for the pneumonia when the calves are younger than 7 days old. And it slightly depends, are they dairy calves or suckler calves? If you could quickly perhaps put that in the answer. It would, the list of possibilities would be different for both, but if they're getting it that young, then it's possible there could be something going on in the womb. They could be aspirating something when they're being born, or there could be something, even a placentitis, if they're getting it that young, sort of 7 days old. That is pretty young. So I would suggest the next one you get, if it dies, get a proper post-mortem done and get the lungs looked at under the microscope and get a reasonable diagnosis. And I would also suggest, if it's a suckler calf or a heifer, dairy heifer, including the thyroid gland in that post-mortem histopathology, as in look at it under a microscope with the thyroid gland. I would think you want to be certain what the diagnosis is in that case.
Yeah, very, very sound. So just got time for another couple questions here. This is a this is a good question. So bringing it back to scour, I'll give you a double. So we've got one question, can you vaccinate against crypto? And then someone else saying that they sometimes see mucousy blood in young calves, and it doesn't seem to affect their health. They're about 2 to 3 days of age. Is it anything to worry about?
Interesting. Well, if they're not sick, then no, I would probably guess. So can you think of anything that might do? That's, yeah. If they're not sick and they grow, I don't know what that'll be. Perhaps a bit of E. coli, but it would be unusual that. But if they're not sick, then can't think of anything. And then crypto, yes, you can vaccinate now in the same way as you can vaccinate cows for rotavirus, coronavirus, and E. coli. There is a new vaccine on the market for crypto, which would be worth talking to your vet about.
Brilliant. Okay.
But again, I think crypto is probably an environmental disease. Sorry.
Last question would be, is there one vaccine that does all pneumonia?
No.
No, which is unfortunate. But yes, it's multifactorial situation, isn't it? Like you've touched on, Ben, but yeah, lots of things to think about, and maybe
just quickly though, calves less than 6 months old, the younger the better. RSV, PI3, and coronavirus, those are the ones you need, possibly in Mycoplasma bovis. Calves above 6 months old, IBR.
Brilliant. And the only thing I'd add to that is if you're really struggling, would speak to your vet, try and get some diagnostics and see exactly what those bugs are unique to your farm.
Yes. And sometimes the vaccine companies are very helpful in investigating these outbreaks, especially if vaccines have been used, because they're as keen as anybody really to make sure the vaccines remain effective and if we're targeting the right pathogen. So they can be very helpful in investigating these issues.
Brilliant, thanks, Ben.
Just at that point, it's probably time to start bringing this to a close. We sort of reached the time. I'd like to thank you, Halcyon, for giving your time this evening and facilitating conversation with Ben. Ben, I'd really like to thank you for your time, effort and energy in creating the films, but also coming on this evening and talking so passionately about what you really love to do and how you really like to help farmers and keep stock healthy. It's been a fascinating talk to listen to. I'd like to thank farmers and associated industry for joining. And of course, these things don't come together just by chance. So we'd really like to thank Kyle, who sits in the background and makes sure that all the videos play and the sound keeps good for us. So thank you, everybody. We hope that you enjoy Calf Week and come to many more of the webinars and meetings that are around the country. And we hope to see you all again soon. Thank you.
Thank you.
Thanks, everyone.